Hey guys, my name's Sam and welcome to Paramedic. In today's video, I'm going to be giving you an overview of the jump bags that we use in our ambulances. So getting right into it, a jump bag is the bag on an ambulance that the paramedics or EMTs will take into a residence to render aid to a patient until they can be brought out to the ambulance. For these bags, we actually use two and we use them in a system, so these bags are used together. The bag on the right is, I believe it's a med slinger from StatPack, and this is our basic bag. This is something that comes in on every call with us, no matter what it is, whether it's super severe or something that's really minor. And then on the left, this is the StatPack breather, but we've actually modified the contents and how it's organized to fit our needs. And we call this our dead man's bag. So this bag is for when this bag can't cover everything we need it to do. And this will have everything we need in it to take care of a patient for a period of time until they can be extricated to the ambulance. Let's start with the slinger, and then we'll go over to the dead man's bag and show you what's in both of these. All right, so the slinger in the top pocket, we carry a glucometer. It is kind of a mess in this pack. We've got another pack coming. The reason we have a glucometer on the far outside of the pack is we have a fire department that responds with us to all our calls, and they've got all the regular vitals equipment. So oftentimes, if we go in for a minor complaint, minor pain or fall, whatever it might be, we're just going to bring this bag, and this might be the only thing we use out of it because this is the one thing that the fire department doesn't have and isn't able to assess as far as vitals go. We also carry a vomit bag in that exterior compartment. In the first compartment here, we carry a couple things. In this main part, we have a SAM splint, which is for splinting an arm. I've got a video on that. And then we have a cold pack. We've got some rolled gauze, Coban, a cat tourniquet, and a couple rolls of tape. So obviously the tourniquet's for not minor trauma, but this is for the calls that we go into and we're surprised by a massive hemorrhage or something, even though it sounded minor to begin with. And then the rest is just your minor trauma supplies, the things that you might use on a patient that might not even need an ambulance, but you're going to treat them and help them and go from there. In the top pocket here, we have two saline flushes to flush wounds, and then some 4x4s, and I believe a 5x9 in here for, once again, your basic trauma care. All right, so coming into the main and largest compartment on the slinger, in the bottom part of it, we've got a stethoscope and a blood pressure cuff. In this pocket, we have what's called the RAD 57. And the RAD 57 will give us our pulse oximeter. It will also give us our pulse, and then it will tell us about carbon monoxide inhaled by the patient and give us blood levels of that. So very useful. Behind that, we've got a patient refusal AMA paperwork. It's good to have, especially on those really minor cases where you're just bringing this in. They don't want to go to the hospital. They can sign that you can get out of their hair without having to make an extra trip to the ambulance. And then in this pocket up here, we have a nebulizer kit and a mask if they're not able to hold the kit on their own. It's nice to be able to put on. And obviously a nebulizer is only good if you have something to nebulize in it. And that's why we carry our basic medications right here. So if you've watched my medications video, you'll know that I've been over this already. This has our albuterol, and then our albuterol and Atrovent, so our duonebs for the nebulizer, aspirin, nitro, Zofran, and Zofran tablets. And then we also have blood glucose paste here. Now these medications are not the biggest lifesavers that we carry. That's not the point of this kit, because I know somebody's going to comment down below, well, you should have an EpiPen or whatever in there. These are not those medications. If it's a serious call, we'll bring our entire medication box. These are just the high-use items that we use more than anything else, and that's why we keep them in this bag that we're bringing into every single call. All right, so coming over to our dead man's bag. This bag, like I said before, is everything we're going to need. Now, it does not repeat everything that's in the slinger. We have the slinger on every call, and then this supplements that bag, or vice versa, however you want to look at it. On the front, we've got a CO monitor, so we know if we're walking into a poison environment, we can back out, have the fire department go in and make sure everything's safe, or drag the patient to us if need be. In the top pocket here, we carry our backup airways. So we have our PEDS King LTE tubes here, and our adult King LTEs. And for those of you that don't know, a King tube is a supraglottic airway. It does not require visualization of the vocal cords to insert, really easy to do. And we're using this if we fail to get an endotracheal intubation in the field, or if it's something where we don't have time to do an intubation. We also carry a quick trach in here, and the quick trach is not a great device. This is a needle cricothyrotomy kit. In Iowa, unfortunately, we're not allowed to do surgical cricothyrotomies, so this is the next best thing, and then we have it if we need to use it. All right, taking a look at the side pockets really quick. In this side, we have our vitals equipment. So blood pressure cuff, stethoscope, and then another patient refusal if we don't have the other one. Pretty self-explanatory. And we have the glucometer in the other bag, like I said before. On the other side here, this is all our trauma supplies. So in here, we've got a kit that just has your wound stuff. So your rolled gauze, your trauma pads, your Coban, that kind of thing. In the top flap here, we've got chest seals. And right now we're running Ashermans. We do have hyphens as well. We kind of have a mix of the two. In my experience, both work pretty well. I don't really have a preference, one or the other. In this pocket, we've got a SWAT T as a backup tourniquet, 2 needle decompressions, 2 cat tourniquets, and we keep one wrapped up. It's just going to keep it a little bit more pristine and less beat up, and then we have the other one out of the case for rapid deployment. And that all just folds up into here. All right, so coming to the main compartment of this pack, you'll notice that we don't have this set up exactly how StatPack does, or how they usually recommend it would be set up. They sell these cells here, and I believe this is meant to fit 4 of these, but you'll notice we've got an airway roll and an IO kit that don't necessarily go with it. We found that their cell they make for airway equipment doesn't really fit everything the way we want it to be stored, so we've made these modifications ourselves. So let's start from the top and work our way down. Up here we've got our Easy IO case. An IO is what's called an interosseous device, and this is a needle that's drilled down into the bone, which actually will deliver medications just as well as through an IV, and it's very fast. It is very painful, but for patients in cardiac arrest or that we have no other option, it's a really good device, and it saves us a lot of time in the field. So we keep the IO in here. In this first cell, we have our bag valve masks. I'm not going to go into detail on these. These are just the bags to breathe for a patient. Really, truly, mouth-to-mouth or mouth-to-mask isn't something that's done in the professional venue of EMS. And one point I want to make about having these cells is these are really nice. Instead of just having all our supplies in here in compartments, I can just take this and I can throw this to a firefighter or my partner, and they can start bagging the patient. Or if somebody's going to start an IO, I can toss that down to them. Instead of passing individual supplies, I can just take the entire kit and throw it to where it needs to be. In this one, and it is labeled here, intravenous, this is all of our IV supplies. The top compartment here, we've got all our catheters, so our 20, 22, 20, and 18. We don't have the 16 gauge and the 14 gauge catheters in here because really an 18 gauge is what you need most of the time. And then we have the 16 and the 14 in the ambulance if we do need that super large bore IV for whatever reason. But now that dumping fluids into somebody isn't really in any trauma algorithm, we're not doing that as much. We've got some IV start kits up top, some flushes to flush a saline lock, some pigtails for said saline lock, and then administration equipment for medications. In this pocket up here, we've got a 3-way stopcock and a MAD device. So this is what delivers intranasal medications. And the 3-way stopcock is great for pediatrics where you're drawing up a very small amount of medication in a small syringe from a different vial. And then back here, we've got our bag of saline, and behind that's a 15-drop tubing, and then more administration needles, so your filter needles and stuff for your epinephrine draw-up. Last but not least in this bag, we've got our airway roll. And if you've watched my ambulance tour video, you'll notice this is the same airway roll that's in the cabinets of our rigs. We keep them the same so that our paramedics can know where everything is right away without having to dig through a different kit. In this airway roll, we've got basically everything you need for intubation. Obviously, if we're intubating somebody, we have our cardiac monitor, and that has the end tidal CO2 on it. But on here, we've got our MAC blades on the one side, and the compatible handle, of course. And then we have our Miller blades down here. It's really paramedic preference or situation, what they want to use, if they want to use MAC or Miller. We've got the stylets for the tubes here. We've got a pediatric or laryngoscope handle, and then we've got syringes to inflate the bulb. We've got 2 McGill forceps, 1 pediatric, 1 adult. And then coming through the tubes, we have all the sizes down, it looks like from 3.0 all the way up to 9.0 tubes. And then at the top, we've got 2 tube holders. We carry the end tidal CO2, the side stream end tidal CO2 wiring, but obviously that's no good unless we have the monitor with us as well. And then we have a pediatric tube holder on this size. The only other thing I didn't mention is we do have a sharps container tucked down in the side of this pack. On the lid here, we've got a couple other things. First and foremost, we have our King Vision. So this is a video laryngoscope set. This blade will plug into the monitor here, and it will allow us to do an electronic intubation on a patient. Really, electronic laryngoscopes are becoming more the standard of care. This used to be kind of a backup airway if you couldn't get your airway originally. But really, we use this for our first-line intubation and only use the laryngoscopes if our technology fails up here. Looped over here, we've got a bougie. A bougie is a device that can be fed down into the vocal cords if you can't quite get a tube to conform how you need it to. This is a very excellent device, been around for a long time. If your service does not carry this and you're doing intubations, you should really consider getting this. The only problem is storage, because if it's wrapped up too much, it will bend and contort and be completely useless for you, but it works pretty well here. And then you'll notice in the lid, we've got some OPAs here, and then NPAs and lubricant in here. So this bag is essentially meant to handle anything that we might encounter. So this bag is brand new. We've just started running with these. We were using the red ones that you saw on my ambulance tour video. That was just getting a little bit small for us, and it wasn't doing what we needed to do, so we've changed over to this. Now, before anybody says it, and I know somebody's going to say it in the comments, we do not carry oxygen on either of these bags. We have a separate bag that has oxygen in it that we can bring if we need to. Also, the cot has oxygen, and the firefighters have oxygen. So somebody has an oxygen tank on scene, But as you can see, we carry a lot of tools and we don't really have room for a tank, and we don't really want to make this bag any bigger or heavier if we don't have to. That's all I have for this video, guys. Thank you so much for watching. I appreciate all the support. If you haven't already, go ahead, follow me on Instagram. It's just some snapshots throughout my day, not as much educational content, but if you're into that, go ahead, give that a follow. Also wanted to give a quick shout out to TacMed TV. Great channel if you're into the tactical medical side of all of this. And he's really one of the people that started me doing this YouTube video and supported me at the very beginning. So go ahead, check him out, show him some love, and I will see you guys next week.